Hello friends, today I am going to explain you here about massive hemothorax. So this is a part of traumatology and surgery series for NEET SS and NISS. It is defined as accumulation of large quantity of blood in pleural cavity, 1500 ml or more than one third of patient body volume. Okay, when there is accumulation of 1500 ml or more blood in pleural cavity, then patient, this term is known as massive hemothorax, or patient present with impaired breathing and shock with flat neck veins. Patient in shock, impaired breathing and flat neck veins. However, there will be dullness on percussion. When you do percussion, there is dullness, which differentiate it from pneumothorax. Okay, so this is not a pneumothorax, this is a hemothorax when you find dullness on percussion. It is treated with tube thoracostomy initially, or we can say ICD insertion. And if the patient continues to be in shock due to ongoing bleeding, patient will require thoracotomy. When patient require thoracotomy, when there is continuous oozing, continuous bleeding, okay, or patient continuous in a shock, then we need thoracotomy. Color of blood is not an indicator for requirement of thoracotomy. Remember, the color of blood is not require ongoing. Color of blood is not an indicator for thoracotomy. Indication of thoracotomy in massive hemothorax are initial output of more than 1500 ml with shock. When you put ICD, initially, immediately, there is 1500 ml blood and patient in a shock. Then this is a clear indication of thoracotomy. Persistent bleed 200 ml per hour for 2 to 4 hours. If patient output every hour is 200 ml blood till 2 to 4 hours, then this is an indication of thoracotomy. It is to be understood that these parameters are seen in the light of physiological status of patient and not in isolation. If patient is hemodynamically unstable, even while not fulfilling the chest drain output criteria, and other sources have been ruled out, an emergency thoracotomy is indicated. This line means when patient drain output is not more than 400 ml initially, or when there is no 200 ml every hour till 2-4 hours blood and is still patient in a shock, then this is also indication of thoracotomy in spite of not fulfilling the criteria. In the physiological along with the anatomical injury which guides the management, and the goal of treatment is to restore the physiology followed by anatomical restoration. Okay, so this is a case of massive hemothorax. Let's see here. This white indicates blood. If there is a black, dark black, that is air. But this is massive pneumothorax fluid. And you see water seal back with blood inside the drain. So guys, this is the picture of massive hemothorax. If you like this video, put like on it. I hope your concepts are very much clear now about massive hemothorax in very short and sweet duration. This massive hemothorax is also considered as life-threatening, immediate life-threatening condition. Immediate life-threatening condition. So guys, your intervention will save patient life. And if you like this video, put like on it. If you want such more videos on trauma and surgery series, and this is also a part of ATLS. So this helps in ATLS and NEET SS or NISS exam. Lot of MCQs from this lecture. Thank you.